Hello everyone, my name is Sukhdeep Singh. I'm from Alexandra College and studying psychology from Professor Benjamin Wong. I'm here to present analysis of dialectical behavior therapy, which is also called DBT. As a form of CBT, DBT was developed in early 1980s to offer treatment to persons with BBD. These individuals who suffer from personal destructive conduct and experience intense emotions with which they cannot regulate. DBT has since 1980s adapted to treat mental disorders. Dr. Marshall Inhan aimed when developing this approach to come up with a treatment approach that validates the client about their feeling while also aiding one to change those negative behaviors. The approach is grounded on three core principles. One of principle is dialectical thinking. This is the idea that client has to balance the need one has for accepting the current state of emotions and desire for the change. As such, a client has to balance acceptance and change. The another principle is skill development. In this, the approach teaches the client skills that they can utilize to manage their emotions and live happier life. Additionally, the collaboration is another principle that serves to offer an equal chance for both clients and therapists to collaborate in, in the alliance in setting goals. It can be argued that the core philosophy of this approach is to make client focus on accepting the present situation as it also works towards the change. Because DBT evaluations over the year, it's widely used today to treat several mental disorders apart from BPD. These disorders entail the suicidal behaviors, eating disorders such as bulimia, PTSD, substance use disorder. This approach helps to client manage their emotions, making it easy for them to reduce negative thoughts, which cause suicidal thoughts. Also, through the emotional regulations, this approach has been effective in treating substance use conditions, depression, and PTSD. Unlike CBT, DBT has integrates a multi-layered approach which makes it effective in its treatment of mental disorders. It is composed for four main components which include emotional dysregulation, mindfulness, distress tolerance, and delivery methods. Mindfulness. Mindfulness is meant to teach clients to stay present while observing their thoughts and feelings without judging them. This way, a client become more aware what they are going in their life. Distress tolerance offers client with tactics for tolerating stress and to avoid using strategies that harm the client. Emotional regulations aim to teach the clients how they can recognize negative emotions, how to label them, as well as how to change them. The last component is interpersonal effectiveness, which is about enhancing communication skills. This way, the clients learn how they can express their needs. Therapists can deliver this treatment through group skills, personal therapy sessions, and phone coaching for crisis support. When it comes to effectiveness, DBT has been shown it's very effective in the treatment of BPT and the other mental conditions. Research has shown that the treatment leads to about 80% improvement for patients suffering from BBD. Additionally, this approach leads to reduced self-harming behavior among patients under this treatment approach. This is because it leads to improved emotional control and interpersonal functioning. Nevertheless, the approach requires a lot of resources because of its many components. In terms of future development, this approach is evolving. For instance, today there is use of adolescent DBT that is used in addressing emotional dysregulation among teenagers. This can be used in teletherapy settings and correctional facilities. Further, there is an integration of approach to digital tools like mobile app for skill reinforcement. In conclusion, therefore, DBT has many effective in aiding clients to regulate their emotions, hence treating different mental disorders. It's been effectively used in treatment BPT, substance use, and eating disorders. With the evaluation of this method, it is clear that it will offer more benefits to client. Thank you very much. That's all for today.